Good afternoon and happy Friday. Welcome to the COVID-19 Learning Community, hosted by the COVID-19 Command Center and powered by the Joint Information Center. Some housekeeping. By default, all participants will be muted to minimize distraction. For Q&A, please use the raise hand function at the bottom of your screen. When called on, please unmute your microphone to ask your question and remute your microphone when not speaking to minimize background noise. When speaking, please announce yourself and speak slowly. You can also enter your questions or comments in the chat panel. Please hold all questions and comments until after the presentation portion of the event. Today's meeting objective is to review the current state of the SF COVID-19 epidemic and local indicators of hospital capacity, disease situation, and disease control and current testing efforts. Also, to highlight novel ways to educate potential testers using video. And last, to describe influenza vaccination efforts to prevent a twin-demic. Here's today's agenda, and I'll turn it over to Jafria Morris, the Equity Officer of the COVID Command Center. Jafria, the floor is yours.
Thank you. Hello, everyone. I hope you are staying cool out there. Just some exciting news about our community learning. I know many of you have wanted to know where to find some of the videos that, because we do record every Friday. So the JIC has put up several of our videos for the month of September on a YouTube. So I'll be putting that in the chat. And then I've also been able to talk to Director Davis with the Human Rights Commission of them creating a tab of COVID-19 so it can live under a URL in case you all want to grab it or paste it. So I'm excited to say that, and that should be rolling out next week, but I'll put the YouTube tabs in the chat. We have a very exciting day today. I hope you all are ready, give good questions. And I thank you all for coming every week, learning more about how the city is addressing all COVID concerns, COVID-related concerns, as we continue to lower the curve. Thank you. Oh, Dr. Fuchs, you're up.
Thank you so much. Good afternoon, everybody. We're really excited. As you saw from the agenda, we're going to switch this up a little bit. We're going to start with our bright spot with our conversations with Glide, and we're really excited to have Dr. Kenneth Kim join us today to talk a little bit about, as we called it, lights, camera, action, the use of video to try to highlight testing educational efforts. And they've done some really great work to pull together a video, which you'll see shortly, but I want to hand it over to you, Dr. Kim, to give us a little bit of background and take it away.
Great, thank you. So we've been hosting COVID testing here at Glide for almost 3 months now. And like with everybody else, really kind of struggling with how we can improve outreach and engagement with families and residents here. One of the things that we had been hearing in this meeting and through community conversations is the fear of actually getting infected at the test site, or the fear of whether test sites were safe enough or not. And certainly at Glide, because we provide so many services, a lot of the visuals that people have are like our meals line and really thinking that that's unsafe. So we got together and started, really brainstorming about some possibilities. And from our previous, efforts with like safe injection sites, we thought we wanted to put something together that felt very local, homegrown, that we can then present to the community and hopefully give them a visual of what it would feel like to come to and get their COVID testing at Glide. It was our intention to make sure that this felt like something that was like a cable access kind of feel to it, and also that the folks that are in the video are familiar faces that they've seen through other advocacy efforts and service efforts as well. I have to add also, like the Glide team did a great job of shedding their shyness to be on camera, and was really creative, I think, in just looking at internal resources to do the editing and the voiceover and all of those things. And we wanted to share that with you, so hopefully it would inspire other testing sites to take this, and also just kind of learn from each other, things that we can do to improve messaging, as well as what it could look like for different communities and different cultures as well. So I'll go ahead and share the video.
Welcome to Glide. We are located at 330 Ellis Street on the corner of Ellis and Taylor in the Tenderloin. Every Tuesday and Wednesday, we offer free COVID testing between 10 a.m. and 4 p.m. in our parking lot. Please remember to wear your face mask when you visit us. And please remember to keep a safe 6-foot distance from everyone else. You may register to test on the same day. Youth ages 13 and older may test without parental consent. Youth who are less than 13 years of age will require a parent or guardian to accompany them to the test site and provide parental consent. We will collect some basic information from you, like name, birth date, email, address, and cell phone number. The cell phone number and email address will be used to contact you when your results are ready. Results are usually ready between 1 and 3 days. You will be contacted via email or text message to notify you that your results are ready for viewing. If you need assistance with that process, Glide staff can help you. When it is time to test, the clinician will review some testing questions with you. They will explain the process to you, including what the procedure is like. They will use a cotton swab to collect specimen from your nostrils. They will ask you to pull your face mask down while still covering your mouth. The process is not painful, maybe a little ticklish, but not painful at all. After you test, you will be given a card. The card will consist of a barcode with a number. When your results are ready, you will be contacted via text or email. You will enter this barcode to view your results. It's that simple.
So a couple things to add is that video originally was done in Cantonese. And one of the things that was highlighted by Lillian Mark, who will join us later, and she's the one that also did the voiceover, is that there was actually much more with the Cantonese version, because one of the things they wanted to do was make sure there's a lot of reassurances. And she's a familiar face, and right now we're working on one in Spanish that will actually highlight what it will feel like for families to come and get tested. And then lastly, we did also want to keep it short, and so we did not include a lot of the information on what would happen if you're positive. So I think once we, get some feedback on this, see how it works, that's likely to be our next video project, is providing information on what you can do. And we'd love to really try to be a lot more inclusive with the community around that, because a lot of it does involve like what they can do at home. We're not sure if we want to do some kind of like animated thing with doodles, or have volunteers come in and maybe expand the video a little bit. But that's kind of what's next in line for us in this effort.
Fantastic. So we have some time now just to get some feedback. What did you, maybe if you want to share, you can come off mute if you want to share that verbally. If you want to offer comments in the chat, please do. But what did you particularly like about it, and what kinds of things do you think would be helpful to reinforce or change? And then also to speak to Dr. Kim's point, what are some of the other things you would want to see in a future video that would really talk about, so what happens if you test positive and what does that mean? Or even if you test negative, what does that mean in terms of when should you consider retesting, and et cetera. So we'd love to hear folks' thoughts. You have the ability to come off mute and share them, please.
Hi, this is Valerie. Congratulations on the video. That was great. I do have a couple of questions, technical questions, like who did the video, who's your videographer, and also who funded it. And then also it would be nice to maybe do something that has like a 10-second shot of all the testing sites and their locations, so that people do have access to where they can get it at. But I love the video. I thought it was beautiful. Thank you.
Yeah. Well, I think what we're really trying to share is the recipe and not necessarily the dish. That because this had zero funding to it. We basically just, it was a process of voluntelling. And it was actually our project coordinator who just happens to know how to use iMovie. And so all of this was just done with an iPhone. We used the iMovie app to edit it. And we are trying to put together some best practices that we can share with folks in terms of like the technology, the script for the voiceover. And I think the hope was that each site could have their own video, so it felt very local. Because I think the disadvantage would be that, or the advantage to take is that if somebody in the video is actually a familiar face, there's an affinity and I think a connection and a relationship we can take advantage. But we are trying to put together all the information so we can just kind of hand it out in a kit for folks to be able to do it themselves.
Thank you.
Hi, this is Liza. May I ask if we have a plan in place for those that are homeless that do not have access to internet or an email or a phone? How do they go about getting tested and finding their results?
Yeah, so at Glide, we actually do street level outreach as well. And we, just similar to the event that happened recently down in 100 Golden Gate, we do provide information on testing as part of our outreach efforts. And then we've actually utilized our walk-in center for folks that don't have access to phone or internet. And we've done that basically with a release form and just getting permission that we can help them assist with their results.
I think that would be interesting to add to that video. I think then as messengers, we can let people know that aren't privy to this information. Hey, you can go to Glide and you don't have to worry about it. They'll guide you through it, just enforcing that safety and their health is the first most and not technology or a way to access their information. Thank you so much. So I think that would be a good add to that video. And the video is really cool. Is there a place where I can find it or can you post that link or are we not sharing it yet?
We have to redo the voiceover to add a couple of suggestions, but yeah, we can definitely share it. Our plan for distribution is just only through our social media, since like specifically with the Spanish-speaking families, a lot of our FRC families actually do use Instagram and social media. So that's the specific target that we're gonna do. This first one in Cantonese may not be as conducive for social media, but that was the group that was really ready to go first. And we're actually in production right now with the Spanish version of it. And I think because of others inside Glide that have seen it, I wouldn't be surprised if we have a couple more different versions, like what Lisa was suggesting around how to target this towards folks that are homeless. But we haven't thought it through all the way. So I think if there are other suggestions on where this could be posted or how it could be utilized, I think that's great feedback.
Sorry, it's Liza again. I would like to get it in Cantonese because I would like to post it on the Tenderloins People's Congress, and they are very familiar with the, I think the Asian community. So every language that will reach that's a great format, and we can put it out in every language. And I think that will, that's the population we work with. So I would be happy to share it there also.
Okay.
Hey, this is Jafria. Great. I've been trying to get you took my thing. I would say Arabic for the Tenderloin too. Correct. No, I've been talking to our JIC, and since I started as the equity officer, I've been saying we need videos because people always would think that everyone reads, even if they're in their native language. And we got to know that vulnerable populations, a lot of people reading and literacy is high. So I'm so happy to see this. I agree with Valerie's suggestion. And it's up to you all because we would love to kind of poach or take your video and maybe we can hire our own people to add the other sites, but why reinvent the wheel? Because this is exactly what we need at all our testing sites to continue. And I'm happy that you all kind of paved the way because this is something I've been asking for months now.
And maybe what we can do is if we can collect people that are interested, then we can certainly set up like a technical assistance meeting, and I could get Lillian and Saba, the folks that work on it, to answer questions about the details of how we produced it.
And I know, like, I see some HRC people. I'm kind of like a surrogate a little bit from the HRC. I see like Amelia, and I think this would be something great that we could ask Director Davis. Maybe she'll have a little fun to help us with this. This would be great.
Yeah, no, I think, yeah, we are now giving it to the community to do what seems right with it. I think this was just kind of a first step for us, but I'm glad it's having this kind of impact where people are inspired to do more. But I think for the Tenderloin, it was going to be hard for us to think of just producing 1 or 2 videos that was really going to match. And so we did think of it as like, what is the initial outline that we want to do? And then what are the adjustments that are going to need to be made so that each video does have the cultural humility as well as the competence that's needed. Yes, volunteers would be great. It'd be really cool to collaborate, and then we're more than happy to assist in other neighborhoods if you want to take on this task of creating a video. Like I said, the staff actually had a lot of fun with it. So it kind of unexpectedly became like a team building exercise. And when we shared it with our program managers and leadership, it was a great response, but it was also interesting to see who was ready to get their makeup ready and be on camera. So that's also where I would encourage folks to take on the project within your own teams, because it was a really positive experience for us to do.
And it sounds like so congratulations again. I completely agree. It's really inspiring, and thank you to your entire team for pulling this together. I think it's a good question. Like one strategy could be, okay, let's work with the JIC and develop a few versions and then make those available, or as you're maybe, and what we're hearing is maybe that this should be hyper localized, and maybe we just need to help. Like you had someone who was really great with iMovie, but maybe some of the other community partners here don't have someone who has that skill set. So do we harness maybe some of that capacity with the JIC, but then we help to produce very hyper local videos for different community testing sites. So there are a lot of ways to go about it. So I'd love to just, get some additional guidance, or I think all of us would love some additional thoughts from the team about the best approach there. What do people think who are interested in seeing videos being developed? Oh, Valerie, I love Valerie's just, thank you so much for that suggestion. So
great idea.
TV might be another way, right? I mean, there's existing infrastructure. So can we harness that in some way? But Valerie, and not to put you on the spot here, but like, for example, do you think that maybe you utilizing that expertise, but then doing hyper local ones, like for example, at the Mission Hub, or what are your thoughts on that?
You know what, I thank you again for showing this video. And yes, we're gonna steal that idea real quick. For us, we have a resource hub. And so I was thinking about doing a short video. We have a table that is housed by Clínica Martín Barros. So we could have like a TV monitor there that loops a video, so that if people are concerned while they're waiting for their appointments, or they could go by and listen to it in Spanish, so that it could dispel any fears they may have. They could see how easy it is. So I'm already gonna bite the idea of that video. So thank you. That's how I'm planning to use your idea. Thank you so much.
Awesome. Yes, great. That's a great idea to have it looping in the waiting room for another service. I mean, yeah, I think, yeah, that's great. It's brilliant.
Good. Other suggestions or ideas about how they would like to use the video or the video concept?
I just think, like, for expediting stuff is that, I know I've just been saying this over and over, and our JIC is doing so many campaigns, but this kind of stuff needs to hit our testing sites immediately. I'm just, this is what I've imagined, and it hasn't really taken off yet. And to see it and now have, even with the voiceover, I didn't know, I thought my Wi-Fi was messing up, but it was amazing. And I really, it would be great if you guys could put it up on Glide website, so people could easily grab it. That's what I would say, outside of just
yeah, we should have the edited voiceover done by Monday, and so I'll send the links out for both in Cantonese and in English. And then we do have a COVID web page on our page, and as other videos come out, if there isn't this kind of conversation, you can always check on there where we have our testing information, and we'll have these videos posted there as well. But yeah, I mean, definitely contact me. I'll put my email up. But I think the more we can just kind of get organized, if there's a group of people that would like to just get information, I'm more than happy to host something to share our efforts.
Thank you for that. And I think you also highlighted another important need, which is, you know, is the next steps is what if you test positive? Because again, with the whole test and response strategy, it's the positive test, it's the rapid isolation, the support for isolation, about retesting if you're positive and trying to discourage that, the right to recover funds, like what is going to help also motivate people to know that they're going to be supported and taken care of to safely self-isolate, and what about their families, all those kind of key questions that come up. And there's been a really good discussion of just, again, a shout out to Eileen Loughran and Dr. Vincent Fuqua and others who've really put together a pre-test and post-test counseling guide. A number of people have given feedback on that, but that could be also serve as a really nice the kind of a basis for developing new video content that address some of those core questions that everyone has that need to be addressed. I'm curious if anyone, before we move on to the next, any thoughts about that piece, about what messages to share?
If you're talking about just messaging, I'm sorry, I caught the tail end. I think that we should have something updated for every acknowledged holiday, because I think that there have been spikes. I think we've seen right after holidays. And so how to work with the JIC and how to do some holiday prevention work. Like, for example, we're having discussions around Halloween and Dia de los Muertos. And so we're trying to teach culturally how people can safely come together, because they're going to come together no matter what. They're going to come together. So how do we encourage safe behavior that's culturally relevant? So my 2 cents.
A great suggestion, Valerie. Thank you for that. And I would say that I think that's also just in general for these videos, that there's always a prevention message with every single one of them about the importance of masking, of distancing, and of, you know, disinfection, hygiene practices to support. So I appreciate that. And then to make sure that those messages are delivered in a culturally responsive way. So thank you. Great. Any last thoughts about that? Good. Thank you so much. Thanks to you and the Tenderloin and the Glide team for pulling that together. Really appreciate it.
NAP districts, we definitely need to work on that. So thank you so much. I know our next presentation now is Maryna, who will be talking about the twindemic that we may experience if we don't use proper precautions. So Maryna, are you ready?
Sure am. Thanks, Jeffrey. Hopefully we won't experience it at all, but I'll talk a little bit about it. Hi, everybody. My name is Maryna Spiegel. I'm with the community branch. I am the liaison between the community branch and the flu vaccination team. And also on the call here with us, we have Emily Raganold, who is the flu vaccine program manager. So most of the time I'll be talking at you, but we'll have some time for questions, and Emily will be here as well to answer some questions that I might not be able to, because she's much more of a flu vaccine expert than I am. So without further ado, what we wanted to share with you today is the importance of flu vaccination, the current flu vaccine recommendations, and talk a little bit more about myths and misperceptions about flu vaccine, as well as where to get vaccinated and our joint CCC efforts with the community partners. So where I wanted to start with, because somehow this was new to me when I jumped into the flu work, is that flu season generally runs from November to April, which is why we start really pushing that vaccine in October and November so that folks get vaccinated earlier in the season. But in terms of flu illness, that usually peaks around December through March. So that's where the most people end up coming down with the flu. And which is also why getting that vaccine in October, November is recommended. But it's never too late. and we'll get to that in a minute. But just to kind of put it all in perspective, these are the figures from nationwide from the last flu season. So 2019 to 2020, the CDC estimated that as many as 56 million people suffered from the flu, came down with the flu illness. That resulted of as many as 26 million flu medical visits and 740,000 flu hospitalization, and as many as 62,000 deaths related to the flu. So this is not a joke. The impact of the flu is much higher than many people think in terms of the severity of the illness and the potential for hospitalization and death related to the flu. And that kind of puts it into the perspective that preventing flu is critical to also preventing this twindemic. You may have heard this term other people using, and it really refers to the possibility of simultaneous flu and COVID-19 case surges as the weather gets cooler, as people move indoors. You know, there's a higher likelihood of both illnesses occurring. So our goal is to really support all San Francisco residents in staying as healthy as possible to prevent this twindemic scenario. And also to ensure that those who do get sick have access to the medical care they need, because we want to really avoid having folks hospitalized for the flu and folks that are hospitalized for COVID-19, because they require similar resources. And even in a case of a mild flu season, our hospital, we're just really hoping to prevent overtaxing hospitals and the emergency medical systems who are already, you know, coping with the COVID-19 cases. And you can see that a lot of the populations that we've been working with who are vulnerable to COVID-19 are also the same groups who are vulnerable to the flu. And the San Francisco Latinx community, as you know, we talked about earlier with Dr. Fuchs, has been disproportionately impacted by the COVID-19 pandemic. And although the Latinx population only makes up about 15% of the total San Francisco population, you know, they at one point accounted for nearly 50% of COVID-19 cases. So you know, and in addition to that, we know that through national studies, so maybe not so much specific to San Francisco, but nationwide, Latinx communities tend to be less likely to receive the flu vaccination. So only 37% of Latinx community compared to almost 50% of the white folks get a flu vaccine. So we really want to work with the Latinx community, but as well as non-Hispanic Black communities, so African-American communities who get flu vaccine at about 40% rate. So we really want to continue working with the communities to make sure that we keep those vaccination rates up and make sure we protect all of the communities in the city. Next, so there's many unknowns about the upcoming flu season, and because every year the flu is kind of predictably unpredictable. We never really know how bad the season is going to be, and we never really know the specific timing of the flu season. We don't always know exactly how well the vaccine will work to protect against the illness because the virus mutates every year. And we don't know how many people will get vaccinated for a variety of reasons. And this year in particular, there's just no way to know the exact impact of the social distancing, whoops, my bad, social distancing and the masking on the flu rates for our specific populations. And it's unknown what the impacts of this twindemic on the hospital, surgeon, outpatient, and testing resources. will be while the flu and COVID-19 are co-circulating at the same time. What we do know, though, is that there's some encouraging data coming from the Southern Hemisphere. So Australia and Chile, down below the equator, have already had their flu season or kind of wrapping up their flu season. And they saw fewer cases this year, and that could be because of the COVID-19 prevention strategy. And Australia also had higher vaccination rates this year. So that's encouraging, and hopefully we'll see that here as well. The other thing that we do know is that we have many FDA-approved safe and effective vaccines to prevent the seasonal flu. So if some of you remember, 2017, 2018 was a particularly bad flu season, and the CDC estimates that the flu vaccination prevented 7 million illnesses in that season. So that's about the population of New York City. The vaccine also prevented over 100,000 hospitalization in that season. So that's about the number of vehicles crossing the Golden Gate Bridge each day on a normal, in a normal year. So it just kind of paints a picture of the flu vaccine really does help and does create a lot of impact for populations. So who should be getting a flu shot? So the CDC definitely recommends that any person over 6 months of age get a flu vaccine every season. So that's every year, anybody 6 months and older should be getting a flu vaccine. This is especially true for people at higher risk of complications, of medical complications, and the members of their households. So that's people that, like children who are 5 years and younger are especially vulnerable, especially those that are the toddlers that you might hear crying in the background that are under 2. Older adults over 65 years old, immunosuppressed folks, pregnant women, residents of long-term care facilities, or individuals with underlying chronic conditions are at a much higher risk of complications. And as well as members of their household. Healthcare workers are also strongly encouraged, and this year required to get a flu vaccination. So all healthcare workers need flu vaccines because they're protecting themselves, they're protecting their patients, they're staying at work to be able to support our communities better. So we really want to ask all healthcare workers to get a flu vaccine. So that's especially folks working at hospitals or clinics, skilled nursing facilities, long-term care facilities. This year, there is a new health order that all healthcare workers must get an annual flu vaccine before October 31st. So that time is coming up. If they do decline for any reason, they must provide a signed declination. And that's the change this year. So if any of you are working in a clinic, so if any of you are working with patients, go get your flu vaccine. So which seasonal flu vaccines should be given? They're really, as you see on this really colorful chart, there's a variety of flu vaccination formulas available, but any age-appropriate vaccine is great as long as there's no contraindications. And so there's no preference for a particular brand or formulation. For the contraindication that I just mentioned, the medical provider or the pharmacist giving that vaccine should be able to review that with you. There's really very few of those but the medical provider administering that vaccine should be able to identify that. But the flu vaccine is safe for most folks, and again, talk to your medical provider if there's any specific concerns. And so the benefits of the flu vaccine is that it protects everyone's health. So same as the masking and the hand washing that we've all been doing to protect ourselves and our neighbors against COVID-19, flu vaccine is just one more added tool in our tool belt. So it protects you, it protects your loved ones, it protects the neighbors. You know, it reduces the risk of flu illness and the severity of the illness, and reduces the risk of hospitalization and death, especially for those who are vulnerable, who are in those higher risk groups. As I mentioned, protects family, community, so not just the person getting the vaccination, and many, you know, and saves them millions of illnesses and thousands of hospitalizations nationwide. CDC also recommends that all pregnant women receive the flu vaccine at any time during pregnancy, and that Tdap, whooping cough vaccine early on in the pregnancy. And all of that, the defense against the flu and the whooping cough will also get passed on to the baby, and we want to protect both the mom and the newborn against, you know, the flu and the whooping cough. So if you work with any pregnant women, families, just definitely strongly recommend to get that flu vaccine to make sure that the baby is protected, and the mom as well. So next thing, I wanted to kind of go over some of the common flu vaccine myths and facts, and also give a chance for us to hear from you. What are you hearing in your communities about what are some fears or thoughts about flu vaccine? So some people will think, oh, I'm strong and healthy, I don't need the flu vaccine, I never get the flu. And that may be true, but we also want to make sure that those vulnerable groups that are our neighbors, our family members, our coworkers, that everybody is protected. Some people are afraid that the vaccine will give them the flu. The fact is that flu vaccines cannot cause the flu illness. The vaccine itself contains only killed virus or just parts of viral protein. There might be some side effects, but it is not the flu. Other people think, well, is it better for me to just get the flu and get it over with? And again, just a reminder, the flu can be very serious and deadly disease, especially for those more vulnerable groups. So always thinking about not just protecting yourself, but protecting those you might be around. And then lastly, people think, well, if I can still get the flu, if the flu vaccine is not 100% effective, why bother? And the answer to that is that studies do show that folks that do get the vaccine don't get as sick as those that don't. So even if people who got vaccinated do get the flu, they're less likely to feel as bad as they would otherwise. They're less likely to be hospitalized, they're less likely to have complications. Are there any other thoughts or kind of common fears about flu vaccines in the communities that you work with? And I'll take notes.
Valerie, I know Valerie had a question, so Valerie, go ahead.
Thank you so much. Yeah, you know, I always got something to say, so people got to get used to it if they don't know me. So I just want to say that we need to talk about access to the flu shots. I will just tell you right now that I know DPH does not have vaccine inventory. So, and they're not going to get it. It's not going to be accessible until November. I think this is the problem with COVID. We should start earlier than later and not go through the traditional calendar of when the flu hits. The other thing too is so the LTF, the Latino Task Force, could not wait for DPH to have their flu vaccines. So we partnered with Walgreens. So Walgreens is going to support Mission Hub, Excelsior Hub, and OMI Hub. In fact, they're out there today at OMI. So, the other concern that I have though is that, and I don't know if you mentioned this or not, but there are two different flu vaccines. There's a vaccine for 60 and older and under 60. And so although we have Walgreens and we're grateful for them that they can get it together before DPH, they do not have the vaccine for the older adults. So I just want to make sure that people are aware that there are two different vaccines for the age groups. And so, yeah, so I'm gonna stop there. I do want to though emphasize that when DPH does have their inventory, that they make sure that it goes to the community hubs, the testing sites. I will tell you that the flu vaccine yesterday was a major, major hit. People want it, they'll take it. They weren't afraid. So I just want to make those comments. Thank you so much.
Awesome. Thank you, Valerie. That was going to be my next slide to talk about kind of our strategy. But I was wondering if any kind of common fears about flu vaccines have been coming up. It sounds like at the Mission Hub, Valerie, everyone's excited about it and motivated to get it. Is there are there any barriers besides the availability that the community feels?
It was good that that the ones who gave it, that there was Spanish speaker. So that was really good. It was low barrier. In fact, it was almost even more popular than take COVID testing. Do you want to get flu vaccine? Yes. Do you want COVID? No, not today. But so it was a big hit, Spanish speaking, very low barrier, very connected, very close to our COVID testing. So low barrier is very important and culturally appropriate.
I want to put like emphasis on low barrier.
Mm-hmm. Great. Anybody else?
Monica, I know Emily was kind of in the chat answering some of your questions. But Monica, do you have any questions or if Emily, you want to add? Because I see you're helping me with the chat.
No, yeah, thank you. I just wanted more specific information about EdSEP so we could potentially compare, but I'll look at the website later. But also, yeah, just to echo what Valerie was saying, that even in the OMI, like they've been asking for months. And so thank you for LTF for making that hookup happen with Walgreens. So as soon as we can get these flu vaccines available to, you know, our most vulnerable populations, they're asking for it. So they will definitely take it.
Perfect. Well, let me tell you a little bit more about our plans coming up. I know we only have just a few minutes, so I'll try to be quick but informative. So if folks want to get vaccinated, usually if they have insurance, and that includes Medi-Cal, Healthy San Francisco Health Plan, any insurance will cover this as a preventative service. So we recommend that they go to their regular healthcare or pharmacy provider. They can also, anyone can also visit the vaccinefinder.org, and that's a screenshot of different vaccination sites. I know it's kind of tiny, but there's a variety of locations throughout the city. For the uninsured, I'm going to talk quickly about our plans. So we're definitely working to leverage existing health facilities, so the health network facilities, the nursing facilities, skilled nursing facilities, hospitals, primary care, consortium clinics. So our team is working with all of those medical providers to make sure that they have what they need in order to make sure that their staff and their patients are vaccinated. We're also working to safely co-locate COVID-19 testing sites and the flu vaccination at those alternative testing sites at Maxine Hall, Potrero Hill Southeast, and also the Hope SF Sunnydale site. And that should be getting started late October to early November, so just in the next couple of weeks. And we're also working with some of you, like Latina Task Force, to supplement those gaps and co-locate additional flu vaccination services in the community. And those should be ready in just the next couple of weeks as well. So early November, we should be getting started. and going through the end of the year. Just finalizing final touches and final plans to make sure that everything runs smoothly. You can, any of the clients you serve, any of the community members can go to our website, the sfcdcp.org/flu shots. So that's the disease prevention and control website. And like I said, these sites will start doing flu vaccinations in late October or early November. So walk-ins are fine, they're gonna be free and focusing on uninsured folks, but no one will be turned away. Just to wrap it up, because we have just 1 more minute left, our main takeaway from this presentation is that this is not the year to skip the flu shots. So during this COVID-19 pandemic, it's more important than ever for everybody over the age of 6 months to get their annual flu shot. It protects themselves, family, and reduces illness and preserves our scarce healthcare resources. And lastly, flu vaccines are widely available at doctors' offices, clinics, and pharmacies. Those pharmacies do deliver many of the vaccines, and it's great to hear that Walgreens is bringing it to the community as well. And if there's any questions, I'm available. You can always reach out to me, or Emily is on the call as well. Thanks, Emily, for answering those chat questions. We're here and available to answer any of your questions. And those of you who we've already been in touch with about setting up those community-based flu clinics, we will definitely continue to do so.
All right. Thank you so much, Maryna. And I'll put my information in the chat. We have many people from the Tenderloin go to another meeting promptly at 2 o'clock.
Yeah.
So thank you so much. And people can email me or if they have more questions, and I'll forward them to Maryna. My information is in the chat. Thank you again. This was so very helpful.
Thanks so much.
Yeah, you're welcome, everybody. The slides will be sent out, so please don't hesitate to send me an email or Emily as well.
And thank you for joining the COVID-19 learning community. If you have any questions or needs, please contact equity-neighborhoods@sfgov.org. Everyone, please have a safe weekend and enjoy. Thank you.